Did you know that the physical pain you feel might be caused by your mind? It sounds unbelievable, but anxiety might be creating pains in your body that you'd never think were connected. It's not just stress. Your mind is directly influencing your physical state, and the surprising part? You can learn to relieve these pains quickly and effectively. Want to know how to identify if your pain stems from anxiety and how to start feeling better today? Stick around because what you'll discover might change your life. When we think of anxiety, most people only imagine mental symptoms, excessive worry, fear, or nervousness. However, what many don't realize is that anxiety can manifest physically, causing real pain in the body. This happens due to the deep mind-body connection. The physical pain caused by anxiety is a natural response of your body to stress, activating reactions that often go unnoticed. This phenomenon is known as psychosomatic pain, where intense emotions and constant stress translate into physical discomfort. In other words, your body responds to emotional states, leading to a range of painful physical symptoms. Studies show that anxiety raises hormone levels like cortisol and adrenaline, leading to muscle tension, increased sensitivity to pain, and even chronic pain. If you've experienced back pain, chest pain, or headaches that seem to arise without cause, your anxiety might be at the root of these discomforts. Now that you understand the mind-body connection, let's go over the types of physical pain that are most common in anxious people, according to science, and how to recognize them. If you've experienced any of these symptoms, anxiety could be behind them. 1. Muscle pain and tension. When you're anxious, your body goes into fight-or-flight mode, and your muscles contract as a response to stress. This can lead to persistent muscle tension, even after the stressful moment has passed. The most common areas of tension are the shoulders, neck, and back, causing stiffness and pain. Many people with anxiety report constant pain in these regions, as if carrying a weight. I personally felt this a lot, waking up with these aches because my body would tense up while I slept. 2. Headaches and migraines. Anxiety is known to increase the risk of tension headaches and migraines. Mental and emotional stress causes the muscles around the head and neck to contract, creating a sense of pressure and pain. If you suffer from frequent headaches without a clear cause, it might be that anxiety is triggering these episodes. 3. Chest pain. One of the most alarming symptoms of anxiety is chest pain, often mistaken for a heart issue. Chest pain from anxiety results from shallow breathing, which can lead to a tight or painful sensation. While not dangerous, this pain can be frightening and add to the feeling of panic. If the pain is persistent, it's important to seek medical help. Never underestimate these types of pain. 4. Digestive issues. There's a close relationship between anxiety and the digestive system. Abdominal pain, nausea, diarrhea, and constipation are common symptoms among people with anxiety. Constant stress can disrupt gut health, causing discomfort and chronic problems like irritable bowel syndrome, IBS. If your stomach suffers during anxious moments, your body is directly responding to mental stress. 5. Joint pain. Inflammation in joints, like the knees and hands, can also be a response to continuous stress. While not always directly linked to anxiety, the cortisol spike from chronic anxiety can worsen inflammatory issues, leading to joint pain and stiffness. How to identify if your pain is caused by anxiety. If these pains appear or worsen during stressful or worrisome times, there's a good chance anxiety is the culprit. They might come on suddenly, without a clear physical cause, and then lessen when you feel more relaxed. Pay attention to your body. If your pains follow your anxiety levels, there's likely a connection. If the pains are persistent and accompanied by other symptoms, it's essential to seek medical help. Why does anxiety cause pain? The mind-body connection is deeper than most people think. When we're anxious, our body reacts automatically, triggering mechanisms to prepare us for threats, even if that threat is purely psychological. Anxiety triggers a fight-or-flight response in the body, meaning the brain activates the sympathetic nervous system, releasing hormones. These chemicals are meant to ready the body for an immediate threat, but when anxiety is chronic, this alert state remains active, resulting in muscle tension, headaches, and chest pain. Cortisol can cause inflammation in the body, worsening conditions like joint pain and digestive issues. Adrenaline speeds up the heart rate and breathing, which can lead to chest pain and a sense of breathlessness. When you're anxious, your muscles tend to contract. This is part of the fight-or-flight response, designed to prepare the body for quick action. However, in a constant state of anxiety, muscles stay tense for extended periods, leading to chronic pain in the back, neck, and even legs. Accumulated muscle tension can lead to stiffness, cramps, and spasms. Over time, this can cause chronic muscle pain, which only worsens when anxiety goes untreated. When you're anxious, the sympathetic nervous system, responsible for alertness, stays continuously activated. This decreases digestive function, slows blood circulation to non-essential areas, and increases pain sensitivity. This is why anxiety can trigger digestive discomfort like bloating, nausea, and abdominal pain, as well as tension headaches as blood flow is redirected and the muscles around the head tighten. These physiological reactions, although natural, can lead to chronic physical pain if anxiety isn't managed. But the good news is that by understanding how your body reacts to anxiety, you can take steps to relieve these pains. Beyond the usual advice of breathing exercises, meditation, and physical activity, here are some other alternative suggestions I find very helpful. Heat and cold therapy. Alternating between hot and cold compresses can relieve muscle pain and tension caused by anxiety. Heat relaxes tense muscles, while cold helps reduce inflammation and localized pain. How to use it? Apply a hot compress for 15 minutes on tense areas, followed by a cold compress for another 10 minutes. This can be done on places like the neck, shoulders, or lower back. Positive self-suggestion. During moments of pain, it's common to focus on the discomfort, which can amplify the perception of pain. Practicing positive self-suggestion can help reframe how your body interprets pain signals. When you feel pain, repeat phrases to yourself like, "I am safe," "My body knows how to relax," or "This pain will pass." Training your mind to associate these moments with calm can ease physical pain. Tennis ball massage. A practical way to release muscle tension from anxiety is to self-massage with a tennis ball. This technique helps reach difficult areas, like the back and hips, where muscle pain can build up. How to do it? Place a tennis ball between you and a wall, or on the floor, and gently roll over it to massage sore areas. This can relieve accumulated tension in minutes. Anxiety can indeed cause real physical pain and discomfort that impacts your day-to-day life. But the good news is that by understanding this mind-body connection, you can regain control and reduce these symptoms. The strategies we discussed, from biofeedback and magnesium baths to heat and cold therapies, are effective alternatives that can relieve both pain and anxiety. Remember, never underestimate the influence your mind has over your body. With simple yet powerful practices, you can begin to feel relief almost immediately. Now, the question is, which of these tips will you try first? If you want to keep learning about innovative ways to improve your mental and physical health, subscribe to the channel and activate notifications so you don't miss our next videos. And don't forget to share this content with someone who might be suffering from anxiety-related pain. Together, we can overcome this.